In this pilot study, we investigated the racial and gender disparities in asthma education, knowledge, and healthcare access among adolescents. Asthma is the most common chronic disease among adolescents, but not all youths are diagnosed or treated equally. Asthma diagnoses can vary by both race and gender. Racial and gender groups with low reported childhood asthma rates often experience higher rate of underdiagnosis. These underdiagnosed groups are also more likely to experience severe symptoms later in their adulthood. Asthma underdiagnosis could be due to mix of adolescent associated variables or variables that are not adolescent associated. In this study, we specifically focused on adolescent specific variables such as their asthma knowledge, awareness of symptoms and triggers, the perception of their own asthma knowledge, perceived access to care, and their healthcare seeking behaviors. This was done by surveying youths between 10 and 18. For analysis, we compared survey responses between racial group with higher asthma rates to those more likely to be underdiagnosed. We also performed a similar comparison by gender, comparing males with higher asthma rates to female more likely to be underdiagnosed. We observed racial disparity in how participants rated their own asthma knowledge. Participants from racial group with lower asthma rates were less likely to consider themselves as knowledgeable than their peers. We also observed disparities in participants' perceived access to healthcare. Participants from underdiagnosed racial groups were less likely to report that healthcare was extremely easy to access. Likewise, boys were more likely than girls to say they would seek medical help when experiencing asthma symptoms, highlighting behavioral differences that may influence asthma diagnosis. These insights highlight the need for targeted education and interventions to address these racial and gender disparities in asthma diagnosis and care. Thank you for watching. For more information, please refer to our full study.